Good morning, all. Thank you, Solapur IIP, for giving me this opportunity. Thank you, all respected seniors, for being here for today's session. So, already we have a wonderful session on the sonoanatomy of the brain, and now we are moving to the next talk of the today's program, that is basics of the CT brain and its role in the pediatric neurological emergency. The interesting thing about the CT and MRI thing is that everybody wants to know about the CT brain and the MRI brain, but afraid to ask. Why this topic was here? Why we want to learn about the basics of the CT brain? So we know that in emergency, as the patient come in the emergency in the night, many of the hospitals will not have the facility of the MRI. The patient is not the hemodynamically stable. So in emergency cases, we have to rely on the CT brain for evaluating the intracranial emergencies like stroke, trauma, subarachnoid hemorrhage, intracranial hemorrhage. Most of the pediatrician has very limited experience about the CT interpretation. And as I already told, the pediatrician must interpret the basics of the CT brain. The pediatrician must know about the hydrocephalus, must know about the midline shape, must know about the herniation. Because the patient will come in the night, the patient is the serious, hemodynamically not stable. He will send the patient for the CT brain. Patient will come back with the CT films, and the radiologist will say we will give the report in the tomorrow morning. So in such cases, pediatrician must be initially interpret about the emergencies on the CT scan brain, basic anatomy of the CT brain. He should find out the hydrocephalus, midline shape, herniation, rise CT, and should act promptly on them. So that's why this topic was included. What will be the learning objectives for the today's presentation? We will start with the basics of the CT brain. We will see the neuroanatomy of the CT brain in the different planes, in the different sections. Then we will see how to read the CT brain in the 5 basic steps. And I will assure that at the end of the session, you will at least able to read the CT brain in your day-to-day practice in the emergency by simple 5 steps. And lastly, role of the CT brain in the pediatric emergency. So starting with the basic principles of the CT brain. So CT brain was discovered by the Sir Godfrey Hounsfield in the 1972, and he got the Nobel Prize for the same in 1970. There is what are the advantages of the CT brain over the MRI? So it is easy availability. As I already told, most of the hospital will not have the MRI availability. CT scan is the easily available. It is fast. It is the investigation of choice for the hemorrhage, calcification, and disadvantages are the radiation exposure. And we will not get the proper parenchymal visualization on the CT brain. So I will say that CT brain is as equivalent at the sonography. Sonography also, as Sir was already told, hemorrhages, calcification we can detect on the CT scan, USG also. So use the CT brain very judiciously because it is the high radiation. Unless and unless it is indicated in hemodynamically unstable patient, you are suspecting the hemorrhage, we are suspecting the calcification, then and then go with the CT brain. Because it will have the high radiation, most of us will think about the cost. It is low cost, then we will do this, patient is not affordable. But I think it is not the issue. We are spending 2000 rupees for the CT brain and the MRI will come in the 5000. So it is not a big issue. That cost is not the big issue. So use the CT brain judiciously. Basics of the CT brain, very simple basic principle. Different tissues absorb the X-rays by the different degrees. Like air will absorb the X-rays by the different degrees. Tissues will absorb the X-rays by the different degrees. And always describe the findings on the CT brain in terms of the density. So whether it is isodense, whether it is hypodense, or whether it is hyperdense. And what is the reference density? Reference density is the brain parenchyma. So anything that is brighter than the brain parenchyma is the hyperdense, like our bone. And anything that is darker than the brain parenchyma is the hypodense, like CSF and the fluid. So always describe the CT findings in terms of the density. In MRI, Sai will cover that. We will describe in the terms of intensities. It is either hyperintensities or hypointensities. But in the CT brain, it is in the terms of the densities. Either your specific lesion is isodense like brain parenchyma, hyperdense like bone, or hypodense like the CSF. So this is the basic principle when describing the CT brain. Now we will move to the normal neuroanatomy that's seen on the CT scan here. We are not the radiologist. We are just thinking about the basics of the CT brain. We were just thinking about the usefulness of the CT brain in our pediatric emergency. When the patient comes in the night, when the patient is hemodynamic unstable, we have to act in the emergency. So cuts will be taken at the three different sections. That is axial section, that will be the horizontal section, and that most of the films we observe henceforth. The most of the CT films will be getting only in the axial sections. Okay. For sagittal coronal plane, that will be the vertical plane like this coronal plane. This is useful for the pituitary gland and the sella. While the sagittal section are rarely used in the CT brain, they are most commonly used in the MRI. So henceforth, you will observe what are the plates you are getting in the CT films. In 90%, 95% or in the always, they are always in the axial sections. So we will, as we are seeing the basics, we will only see the neuroanatomy of the CT brain in the axial section. So this is axial section, this is coronal section, and this is sagittal plane. So to make it easy or to make it better understanding, I have made some mnemonic. So this is how you will get the CT films. Okay, here is the patient's ID, and we will make the mnemonic. We will read it as a layman. That what will be the first two rows. That is, we will get a picture like a cross. Let's see, this is a cross. Okay, this is the first level. We are going, patient is going into machine like this, and the axial section will be taken from the base towards the, and we will see the 6 sections. Okay, so the first will be, we will look like a picture like a cross. I will see in the detail. I will just show in the this yellow circle. That is, this is a cross-like picture. As we move further, as we move up, we will get the picture like a star. Okay, I will show you that the picture like a star. Further up, we will get the picture like a happy face. I think this will be the happy face. I will show you the detail. Further up, we will see the picture like a sad man. This is the picture like a sad man. Further up, we will get the picture like a two worms. As we are coming at this session up and up, we will get the picture like a two worms, and we will see the neuroanatomy with relation to this picture to memorize it or to make it very simple. And lastly, when come at the top, we will get the picture like a beans. So this will be the picture like a bean. So let's start the first section, that is at the base of the brain. And as I already told, we will get the picture like a cross. Okay, so see, this is a cross. Okay, and what is obviously seen to do is, these are cerebral hemispheres. In the cross section, try to identify the cerebral hemispheres. Then this is the brainstem. Okay, and these are the temporal lobe. So at the first two rows, there we will get the picture like a cross, and there we have to identify the cerebellum. Then we have to identify the brainstem. We will come to the interpretation later. We are just seeing the neuroanatomy here. Then this is the brainstem, and this is the temporal lobe. As we go up, we will get the picture like a star. Okay, so we have come to the up at this level. From the base, we come to the up, and we will get the picture like a star. Not exactly like a star, but if you think of a star, then you will also come to know, yes, it is like a star. Okay, and what the anatomical structures we are seeing here, I am just covering the only basic structures, not going to the deep that are useful in our the emergency. As we are coming up, we are seeing the pons and the medulla, again temporal lobe, and here the fourth ventricle. Okay, cerebellum is also visible, cerebellar hemisphere is also visible in this section, and this is the cerebellar tentorium, which will separate the supracellular regions from the cerebellum region. So this is the second section that will look like a star. Consider this is as a star, and look for the anatomy at this section as a cerebellum, then pons and medulla, then fourth ventricle, and the temporal lobes. As we go up, then we will get the face like a happy man face. Just think, this is the happy man face in the diagrammatic presentation. And this is our actually CT scan, and this is the happy man face. Okay, so as we are coming up, just consider it as a happy man face and try to identify the neuroanatomy. On the happy man face, these two structures are the thalamus. Then these are basal ganglia. Then again, as we are coming up, now we will see the occipital lobes and the frontal lobe. So happy man face is the looking for the ventricles also. Till now, we have not seen the ventricles. So here in happy man face, we will see the ventricles also. So we are coming up, further up, and here we will see the fourth level, that is the sad man face. I see in this diagram. This is the, now we see the cross, we see the star, we see the happy man face, and now we are coming the little bit up also, that is the sad man like face image we will get in this section, and this will be the useful at the level of this. We will see the occipital of the horns of the lateral ventricles along with the frontal horns of the lateral ventricles. Last slide I was forgot to tell, in this image, that is the happy man face. This is the most common image that at this level we have to see for the deep intraparenchymal hemorrhages and sometimes hydrocephalus, because the ventricles we will see at this level, happy face level. So we will be able to identify the hydrocephalus as this level. So at the sad man face, we will look for the occipital horns, and also we will look for the temporal horns of the face. Further up, it will look like a two worms. Okay, it will be the fifth level on the axial side. It will look like a two worms. I am talking about this image. Okay, and what is the importance of what will the neuroanatomical structure? We will look at this image, or at this level. We will look for the occipital horns of the lateral ventricles. Okay, and what is the importance of the occipital horns of the lateral ventricle? It is the most dependent part of the ventricle because of the gravity, and even with the soft hemorrhage, because of the gravity, it will accumulate in the occipital horns, and that is why even the small hemorrhage can be depicted on the occipital horns. And for that, we have to see this type of image where it will looks like a two worms, and finally at the top we will look like a beams. So we are now here. We have come on the top of the CT scan, and it look like a beam shape. And which structures, important structures in the emergency or in a common structure, we will look at this level is this is the flux cerebri connecting the two cerebral hemispheres. We have to look here the gray and white matter differentiation. We have to look here the symmetry of the two cerebral hemispheres. So I think this is for the basic neuroanatomy on the CT scan. Look at the 6 different levels. First is at the base, it will look like a cross. Look for the cerebellum, look for the brainstem. Second, when you go up, it will be like a cross, it will be like a star shape. You look at that level, look for the pons. Further up, happy face, ventricles will be able to see at this level. We will look for the thalamus, basal ganglia at this level. Then sad face, it will be look for the occipital horns. And then further up, two worm stage, it will be look for the occipital horns, lateral ventricles, and lastly, bean shaped. This is like it look like a bean shaped. Flux cerebri and the two cerebral hemisphere, symmetry, then gray and white matter differentiation. So this is the basic of the neuroanatomy on the CT brain. So now the most important part that I have assured you, at the end of this session, you will be able to read the CT brain in your emergency. So 5 steps. Just remember the 5 steps while reading the CT brain. And the mnemonic is blood can be very bad. Okay. So first step, look for the blood. As already told, blood will appear bright, hyperdense on the CT scan. So look for any hyperdensities, whether any blood in the CT scan images. Just show me what is this. It is like a happy man face. Okay, and what important structures we are seeing here? We are seeing here the pons, medulla, then thalamus, and the basal ganglia. And what is the pathology? There is a hyperdensity. And one important thing is we are seeing the CT film like this. Our right is the patient's left, and our left is the patient's right. So this is right side of the patient. So we are seeing the hyperdensity on the right side of the CT brain, and it is lens shaped. So what is this? Epidural hematoma. That is not crossing the suture line. So first look for the brain, blood. Okay. Few other hemorrhages on the CT brain. Again, we are looking at the two worm-shaped like images. Okay. So here we are looking the lateral ventricles of the brain. Then we are looking the symmetry of the two cerebral hemisphere. Whether there is a midline shift, I will come on that. And gray and white matter differentiation. But what is the pathology? Whether there is any hypodensity, hyperdensity, or isodensity on this image? Can anybody able to find out? Yes, there is some hyperdensity on the right side of the CT brain. Okay, and that is crescent shaped. Okay, that is fostering the suture lines. Okay, so it is subdural hemorrhage. Okay, so epidural hemorrhage, subdural hemorrhage, then intraparenchymal or intracerebral bleed. Just compare the brightness in both epidural, then subdural, and then intraparenchymal hemorrhage. It is more brighter as compared to the subdural and epidural hemorrhages. And it is mostly present in the basal ganglia. Can you able to what section, as we told for the pneumonia, is a sad man section. Okay, look like a sad man section. What important structures we will see here? Occipital horns of the ventricles. Okay, and this is the hyperdense region on the right side of the CT brain in the right side of the basal ganglia. That is more hyperdense as compared to the epidural and subdural hemorrhage. And this is mostly because of the hypertension. So this is the intracranial or intracerebral bleed. Lastly, intraventricular bleed. Again, to being shaped, we have to look the ventricles in two, worm-shaped stages or in the happy man phase stage. So you are looking the ventricles, and here having the hyperdensities. Hyperdensities in the ventricles, and this is the intraventricular hemorrhage. Similarly, subarachnoid hemorrhage. So first step, when you are taking the CT films, try to identify the neuroanatomy as we told in the mnemonic. Then try to identify any blood in the films. So that is the hyperdensity in the film. Try to identify whether it is subdural, whether it is epidural, whether it is subdural, whether it is intracerebral, or whether it is intraventricular. Second step is cisterns. Blood can be very bad. To see for cisterns. As sir has already told, what are the cisterns? These are CSF filled spaces in the arachnoid matter and PR matter. So what is its importance? It will prevent the brain from the injury. So these are cisterns. Look for the 4 major cisterns in the CT brain. There are many cisterns, as sir already told. On sonography, cisterna magna, they have to visualize. But in the CT, look for the 4 major cisterns. And for that 4 major cistern, look into the 2 images, that is cross-shaped images, that is at the base, and happy man face level. Okay, so 2 cisterns, that is this one is the supracellular cistern, that is above the pons and medulla, supracellular cistern, and around the pons and medulla, it is not clearly seen. This is a circummesencephalic cistern. So at this level, look for the 2 cisterns. At the happy man face level, look for the 2 cisterns. That is Sylvian cistern, and the face like the quadrigeminal cistern. So first step is identify the 4 important cisterns. At the level of cross, image looks like a cross, and at the level of happy man face. Once you identify it, then try to identify whether it is blood in the cisterns or whether the cisterns are open or closed. Normally the cisterns are open. When it will close? If there is a raised ICT, if there is a herniation, if there is a cerebral edema, this will obliterate. These cisterns will obliterate, and it is the indication of raised ICT. So second step is the look for the cistern. After blood, look for the cistern. Third will be the blood can be, again B. So next B is for the brain parenchyma. Okay. So at what level we will look for the brain parenchyma? In our level, what we made the mnemonic? Bean shape, right? Bean shape. So look the images which look like a bean shape. Okay, and look for the symmetry. Look for the gray and white matter differentiation. Look for any change in the density. Whether you are getting any hypodense lesion, whether you are getting in hyperdense lesion, or whether you are getting in the isodense lesion in the brain parenchyma. And look for the important thing is the midline shape. Whether there is in a midline shape. So how to calculate the midline shape? Okay, you see the midline shape, look the CT films that are look like a 2 beams. Okay, so that you will get the clear-cut visualization of the ventricles. Draw a line between anterior flux cerebri to the posterior flux cerebri. So this will be the midline. So normally it should not be deviated, or till the 5 millimeter it is normal. But if it is deviated more than 5 millimeter, then we will call it as a midline shape. Okay, so look for the midline shape. We are seeing the CT brain in the emergencies. We are not going to the deeper of the CT brain. Okay, so look for the midline shape. We are seeing the 3 steps. Blood can be very bad. Look for the blood. Look for the cisterns, 4 important cisterns. Look whether the cisterns are open or closed. Look any blood in the cisterns. Then B, look for the brain parenchyma, symmetry, then gray and white matter differentiation, any change in the density or any midline shape. The next will be the very bad, that is V stand for the ventricles. Okay, so first identify the ventricles, and then we will see the how to describe the ventricles. So identify lateral ventricles, identify third ventricle, identify fourth ventricle. So to identify the lateral ventricle, look the films which look like a 2 worms. Okay, and have a visual memory of this size. So we have come to know whether it is increase in size or whether there is a decrease in size. So look the film which looks like a two ones, then this will be the lateral ventricles. Okay, then for the third ventricle, look the films that look like the happy face. And as sir has already told, then this slit-like structure will be the third ventricle. And to see the fourth ventricle, look the films that looks like a cross or at the base. And this structure below the pons, medulla, brainstem, pons and medulla, this will be the fourth ventricle. So V stands for the ventricle. And first step is the identify the ventricle. For lateral ventricles, look like a film that looks like a two worms. Okay, we are making the mnemonics to for our better understanding. For third ventricle, look the films that look like a happy face, and for fourth ventricle, look the film that looks like a cross. Once you identify the ventricles, then look for any pathology. Look its the size, look its the shape, look its the symmetry, look its the density, and look for the mass defects. And from this film, it was clear that it is a case of hydrocephalus. Then last step is the bone. First see for the blood, then see for the cisterns, then see for the blood can be brain parenchyma, then see for the ventricles, and lastly the bone. We are not much interested in the bone. We are already told the highest density on the CT scan is the bone. So look for any fracture for that. So it is the, if you want to summarize how to read the CT brain in the emergency, first identify the neuroanatomy. And for that, mostly it will be in the CT scan, it will be in the axial section. We are not getting the CT films in coronal or sagittal section. Mostly we will getting in the axial section. Go from base to the up and try to identify the neuroanatomy at 6 different levels. That is, it is like a cross. What will you get? The cerebellar, then star shape, then happy man face. We will get the thalamus, basal ganglia, ventricles. We can be visualized from above this level. Then we will get the sad man face. Then look like a two worms. Ventricles will be better visualized at this level, and then pin shape. Then pin shape. So this is the normal neuroanatomy. And for reading, read in the 5 basic steps. Okay. So first step is look for any blood. Blood can be very black. Then look for cisterns, 4 major cisterns. Look whether it is open or whether it is closed. That is the indication of rhizolite. Brain parenchyma, symmetry, gray and white matter differentiation. Then ventricles. First identify the ventricles. Okay, where is the lateral ventricle? Where is the third ventricle? Where is the fourth ventricle? And then look for the size, shape, mass effect. And lastly, BAT, this stands for the bone. So, this will be the normal neural anatomy and systemic approach to the CT brain in the emergency. Now, let's have some exercise. What we have seen till the now, let's try to, just I have assured you, at the end, you will be able to read the CT brain in your emergency. So, what is the diagnosis? First, we will be the neuroanatomy and the section, and then we will go to the stepwise approach. So, this is the CT brain axial section. Okay, we are looking at the two beams. Two beams. So, ventricles are clearly visualized. Then, gray and white matter differentiation is there. Now, come to the 5 basic steps of the CT brain reading. First, I told look for the blood. Any hyperdensities. Are you getting any hyperdensities in this film? It is on the left side. Shape. Crescent shape. Then it is, what is it? Subdural. Yes, subdural hematoma. Then next step is the blood cisterns. We are not able to see the cisterns this plane. Then next step the ventricles. Yes, we are able to see the ventricles. Any dilatation or any clean shape the ventricles here. Size. It is normal, but there is some mass difference. Okay, size is dilated. Then look for the brain parenchyma. There is some midline shift. Gray and white matter differentiation is okay. And then bone is not our concern. So this is the subdural hematoma. Another, again, in plane is the axial plane. At which level we are seeing? Again, we are seeing as a 2 worms level. Okay. Any pathology? Now come to the pathology. We are seeing any blood, any hyperdensities in this field? No hyperdensity. We are not seeing any blood in this. Okay. Second, cisterns. We are not able to see the cisterns at this level. Then brain parenchyma. Any hypo, iso, or hyperdensities in the brain parenchyma can be seen in this case. Yes, there is a hypodensity. Look, this is like a CSF. Okay, take as a brain parenchyma as a reference. Okay, so it is a hypodensity on the right side of the brain in the territory of. This will be the so long, so large Right. This is a right MCA will fall. Okay. So it is that easy. So we have to go the step by step. Then we have to able to identify the what is at least emergency. We are not going to the deeper. Whether there is a hydrocephalus, whether there is a stroke, whether there is a bleed, whether there is a mass effect, whether there is a midline shift. Next. Again, plane is the axial section. At which layer we are seeing again two. Again, 2-1 section. Any bleed in this CTMX? Yes. And which side? Yes. And side? Right side. Right. I told it is opposite. Right. Our right is patient left. Our left is patient right. So it is the right side. It is shape from left shape. Okay. So it is as Sir was told rightly. It is the epidural hemorrhage. So next is the blood cisterns. Are we able to see the cisterns in this field? You are not able to see the cisterns in this field. Cistern ventricles. Yes, ventricles are thin, normal in shape, no any mass effect. Okay, can be very bad. Bone it is the okay. Bone we are not able to do the bone. So it is the epidural hematoma. Last one, two more images. So what is the plane? Axial plane CT. Okay. At what levels we are seeing? We are seeing at the again 2 ohms because the ventricles will better visualized at this level. Okay. So 2 ohms. Any hyperdensities in this field. First we have to look for the blood. Any hyperdensities? No, there is no any hyperdensities. Okay. Then cisterns again not visualized. Then brain parenchyma. Brain parenchyma is okay. There is no any mass defect, no any midline shift. Ventricles. It is dilated. Ventricles are dilated. So this is a case of hydrocephalus. And lastly, again, at which level we are seeing? In neuroanatomy. It is the axial section CT brain level. Happy. It is like happy face. Sad will be like this. It is the happy. And the neuroanatomical structures. What will be this? Right. What will be this? Basal gang, right? What is this? Ventricles, right? Okay. And what is the pathology first step? Any hyperdensities? Yes. Yes, I repeat. At what level it is? At what side? At what level? Right side. Right side. And what is it? I have already told it is more hyperdense. So it is the and location also saying it is the intraparenchymal or intracerebellar hemorrhage on the right side of the brain. Okay, so this is
and there is a scalp hemorrhage.
Yes, sir. There is some scalp hemorrhage also. So major pathology along with this scalp hemorrhage also, sir has rightly pointed. Okay, so thank you for this. As we all know, we have to use the CT scan very judiciously because what detect the cancer that can also cause the cancer. Use it judiciously when it is only indicated. In emergency, when patient is hemodynamically not stable, if you are suspecting hemorrhage, calcification, otherwise it is better to go with the MRI, that is the investigation of choice, where we will have the better visualization of the brain parenchyma. And remember the mnemonic 5 basic steps, blood can be very bad. Thank you.
Very good question. You was able to ask for the MRI. Yes, I knew because the noise is so much and to study these children. What to do?
Sir, most of the newborn will be sedated by the feeding also. Breastfeed. If it is not, then we can take the oral medications like pediclorine, hypofloss, then we have and take the Phenergan also. Very few cases it will require anesthesia. I am talking about the newborn. Otherwise, with feeding, with oral medications, we can able to sedate them. But in the children, yes, definitely they will require 5 years, 6 years, 3 years. They will require the anesthesia. Most of the times they will not be able to sedate on the oral medicines. But newborn by feeding also they can able to sedate.